Okay. Hi, I'm Christine Callahan, or Chris, and I've been with the University of Maryland since about 2012. I'm an oncology social worker by background and a social worker by profession. And early on in my career, I just saw through the work that I was doing with patients and families that the role of financial distress, especially when people are dealing with life-threatening or life-limiting illness, is just so profound. So I just really became committed to understanding and addressing financial distress within the context of overall psychosocial well-being. So since 2012, I've been with as I said, Maryland, with the Financial Social Work Initiative, and we do research and education and training, other activities related to financial social work and to really addressing financial distress within our clients and communities. Also since, for about a year now, I've also shared my time with Maryland and then also the University at Albany with one of their research centers in Albany, New York, with a home visiting program called Healthy Families New York, which is a part of Healthy Families America. And my job there is to be rolling out a financial stability program for home visitors and families within this home visiting program. So that's why I'm just very, very honored to be speaking with you today about these issues and to be joining with Allison to address these issues within a larger context as well. Thank you.
I mentioned to Chris before, 2020 has made time lose all meaning. So I could have been there for a day, I could have been there for 10 years, I don't really know. But I finished my MSW in December of 2018, and then I started working there as a social worker not too long after that. And I try to provide both therapy as well as help assist patients with various case management functions, such as housing, identification, and other barriers that they might be facing, and just trying to achieve their goals to help make their lives a little bit more stable. And of course, finances plays a huge role in that. And that was how I ultimately crossed paths with Chris and thankfully found myself here.
Great, thank you. Thank you, Allison.
Thank you.
We can go on to the next slide. I just want to talk a little bit about addressing financial distress within home visiting settings. From what I have learned over the past year, there has not been a whole lot of kind of formal financial stability or financial empowerment programming within home visiting across the nation. So it's really exciting to be a part of this, and like with my work at Albany, really to be involved with rolling out a financial empowerment program within home visiting, which I think is just extremely critical. Maybe we can talk about this towards the end, but with the Healthy Families New York program that I'm involved with through Albany, home visitors ask moms and families just very basic questions about their source of income and any benefits or entitlements that they might be receiving. But that's really about it. And they also ask if they have health insurance, if they have Medicaid, and like I said, maybe different entitlements that they might be receiving, but that's about it. And I just feel that through that work, and through maybe the financial stressors that the moms and families and the kids are dealing with, that there is just a lot that can be done, and a lot of exploration and needs that can be done and addressed within this population. So oftentimes, moms and families and kids are dealing with low income or with lack of health insurance, or they might be targets of predatory lenders, or they might have gotten into trouble with credit cards or with debt. Something that is that is true of all of us. I mean, all of us, you know, can fall prey to you know, to different things, or we might not be managing our money very well for different reasons, you know, but there is just a lot that can be explored and done within home visiting, you know, and also we'll be talking about this in just a moment, but also connection with resources that can really aid in this exploration and really understanding financial distress to a greater degree within home visiting. So I've always felt, and this goes, you know, really in tandem with my work as a social worker and the different settings where I've practiced, that overall financial well-being really just goes hand in hand with psychosocial well-being. And, you know, when we're stressed about our money, or debt, or, you know, just any number of issues that relate to our finances, you know, that really has an impact on our overall psychosocial well-being, and can really, it can add to that stress that we're feeling, and can lead us to, you know, feeling overwhelmed, even feeling hopeless about, you know, about things within our lives. So I just always feel that just, you know, addressing financial well-being, you know, within our assessments and within our work is just a really critical thing to do. And I understand full well that money and finances, of course, are very, you know, they're private, they're, you know, they're sensitive issues with which, you know, to deal, you know, but oftentimes people are really struggling. And, you know, I've always found sometimes it takes a while to really develop that relationship, but people are always really glad to have someone ask, hey, how are you doing? Are you having any stressors, financial or otherwise, right now? Is there anything that's worrying you or causing you concern? And a lot of times these have to do with finances, and people are really glad to, you know, to have that conversation broached in a very sensitive and empathic way. Like I said, there's not been, at least according to the literature that I've looked at and searched, there hasn't been a lot of kind of financial capability or financial empowerment program within home visiting, although there has been some. And I found the work of an MPH out in California, and I'm happy to share that article with you as well afterwards. But she had written about a program that she developed with her colleagues in one of the counties out in California, I believe in the Bay Area. And they launched a financial stability or a financial empowerment program within two different home visiting programs. One was with maternal, with new babies and new moms. That was, they introduced that with a nursing program in a home visiting program where the nurses were trained to address financial questions, stress, and so forth within their work with families, and the families were very responsive. This nursing home visiting program was with vulnerable new babies, and so the families were frequently very stressed, not only by what was happening with their new baby, but then also with the you know, the hospital costs and medical costs and things of that nature. And so they were very receptive and glad for this financial empowerment program through this nursing home visiting program. And then the other example within home visiting that is outlined by this particular author was within a WIC program, and women came to you know, to the center to take part in a series of financial education classes where they learned not only about kind of, you know, the nuts and bolts of budgeting and credit and debt, and things like that. But then also, you know, the relationship piece, which we'll also be getting to a little bit later in this hour, you know, kind of how to talk with my partner about money, you know, what did I learn about money from my family and my background, you know, so really kind of exploring some of those meaty psychosocial issues as well, because oftentimes our backgrounds are very, very influential in how we kind of view money and view its role within our lives and stuff. So, you know, kind of getting into that meaty psychosocial piece as well as the nuts and bolts of personal finance. And I do have to say as well that, you know, just our lives today are just so complex. A term that I often use is like the financialization of daily life. There are just so many things, you know, that are going on with our finances, choices, decisions that we have to make, and that, as we are seeing right now in the midst of this pandemic, and Allison will be talking about that in just a little bit, you know, just the huge financial piece of, you know, of being out of work, of these, you know, the stimulus payments, unemployment insurance. I mean, just all different details, all kinds of different details and issues, even going on today as Congress debates whether or not to have another stimulus payment. You know, but just the financial piece is just huge all the time in our lives, and it just seems to be getting more and more pronounced. Next slide, please. So I just want to touch briefly on what I'm doing with my financial literacy or financial capability pilot within this particular home visiting program. I'm just going to quickly outline the steps that I'm doing. If you could just go on to the next slide, Sue, thank you. This is, so Healthy Families New York has about 48 different sites throughout the state, including New York City. And so this is a voluntary pilot project with interested sites. And I've got about 8 sites thus far. I want to get all 48 eventually, but I'm working, you know, really, really intensely right now with 8 sites. First, what I've done is to disseminate a short survey via Qualtrics on potential financial needs that that families might be facing. And it's just a very short survey, but it just asks different questions about whether or not families would like both information on or help with, or both, on different financial issues that we all face in our daily lives, like budgeting, like help with credit, help with banking, help with taxes, you know, debt, things like that. And I also ask home visitors if they would like to learn more about these things as well, you know, because personal finance is a topic that all of us can really learn from, you know, because we're all dealing with it in our daily lives. So it's this quick survey, and then I just analyze the results and see what it is that people are interested in and what they want to hear about, or what they want help with. So that's the first step. The next step is conducting trainings for home visitors and for families. We had started doing these trainings in person, and then the pandemic hit. So now we're switching to a virtual format, but, you know, just really, doing these trainings and providing educational content around the issues and needs that people have expressed interest in. And, you know, whether it's the things that I've mentioned before, whether it's, you know, budgeting or credit or debt, taxes, you know, talking with my partner, things like that. And then really just, you know, just doing those trainings and hearing people and partnering with, sometimes I do them by myself. I've also partnered with a credit union to provide the trainings as well. So we kind of do them in tandem. And then also for the home visitors, you know, teaching them and sharing how they might weave some additional questions weaving in those questions conversationally into their intakes and parent surveys and all the types of assessment things that they're doing with families, so that they can kind of get more of a sense of what might be happening with the family, and that maybe the types of financial distress that they might be dealing with and that they might want some help with. Now, I do want to say the home visitors are not, they're understanding better what's happening with the families, but that kind of leads me to the next thing, which I'll go into in just a moment, the resource guides. They are not the ones actually doing kind of financial counseling or financial education, you know, but they are, they're finding out what people might be stressed about, and then pointing them in the direction of help and resources within their area. And so that's what the resource guides are all about. If we could go on to the next slide. So what I've done for each site, and sometimes these are just by county, like in New York City, it's by borough, but I've crafted these large resource guides on where home visitors can turn to for help, and finding out about what resources are available within their areas for moms and families. A lot they already know about, you know, like food banks, or where to get diapers, or where to go for social services, or you know, entitlements or benefits, things like that. But there's a lot of other issues that come up with families that they hear about, but are not necessarily kind of working one-on-one with within their regions. And so here I've just kind of these are the headings of how I have organized the resources within each area. So then under all these headings, then I've included all the different agencies and places that are offering assistance around these different needs. So, you know, I'll point out like the debt and the credit counseling, or the financial education and financial coaching domains. In a lot of areas, there are nonprofits or other organizations that are providing like free one-on-one financial coaching to any resident. And so for, you know, say for more specialized services, or if a person wants financial coaching, or if they want to know where they can go to get their taxes done for free, you know, or any other issue, you know, this is listed on the resource guide, and the home visitor can direct moms and families to these resources where they can go for, you know, for more specialized and more intensive one-on-one help. You know, so it's been really interesting. I've done this both in Maryland and throughout New York State, as well as finding out about other programs in the country where these really fabulous places, financial empowerment centers, other financial coaching entities are, you know, are built to just meet with people one-on-one, either in person or virtual, you know, to provide that, you know, that really specialized financial coaching or financial counseling, you know, intervention that people need, especially if their problems are pretty complex, you know, be it if it's, you know, if it's credit, if it's legal, if it's taxes, things like that. So, so that's that. I think if we could just go on to the next slide. Oh, sorry, if we could just go back. That is my pilot project in kind of in a nutshell, but I'm just finding that people are just very, very receptive and, you know, very eager for this financial stability and financial empowerment content, not only for themselves, but also for their clients and communities, to really tackle, you know, issues of financial distress. and to make things better in life. So with that, I will turn it over to Allison. Thank you.
There we go. Thank you. Thank you, Chris, for that amazing introduction. So much of at least what I hope to share is at least half as informative or empowering as everything that Chris just shared with us. But as a brief backstory, I've shared this with Chris and Charlotte before, but shortly after the legislation or the CARES Act passed, and there was more and more discussion of the stimulus checks, one of the doctors at our clinic emailed me over the weekend, which is an offense in and of itself, but she emailed me over the weekend and asked if I had a plan for how to get everyone who's eligible in the clinic their stimulus checks. And we serve roughly 800 to 900 patients, and I'm the only social worker. So I really wanted to reply and ask her if she had a plan. But it did get the ball rolling because I wanted to develop something that could ideally be used by the addictions counselors working within our program, because at least then it would be more likely that the counselors could communicate with their the patients on their individual caseloads and actually have something to help guide their questioning, because this wasn't just new for counselors. I mean, this was new for all of us. And by even just taking a look at the IRS's website on a semi-regular basis to see when things were being posted and their frequently asked questions page and all that kind of thing, it was clearly a new thing for the IRS too. So because also too, because of the institutions that we would be dealing with as far as the stimulus checks were concerned, primarily, of course, being the IRS, such a large, intimidatingly large and bureaucratic institution that may not necessarily, provide all of the guidance that that one might desire to navigate complex issues. So this particular document that I just I have a problem with words and with wordiness. So sometimes the titles of my documents are just very clunky. So I apologize for that. But this particular document, which I am more than happy to disseminate if anybody would like to go through it in greater detail, I just kind of on a whim titled it the stimulus check screening and needs assessment form, because I wanted it to be kind of an all-in-one packet of sorts that a counselor who has never had any experience as far as helping their patients with anything to do with finances could comfortably look at it and use it as a prompt or a template of sorts. Because as my my favorite fortune cookie, I think I found this several years ago, and its wisdom has stayed with me, which is that a problem clearly stated is a problem half solved. And ultimately, if we don't know the questions to ask, then we can't really find the answers, or the answers really won't make very much sense. And of course, when it comes to very large and complex things like the IRS, there are so many nuanced things that could completely change a course of action. But if someone doesn't necessarily know what they don't know, or if someone doesn't feel confident, doesn't have the vocabulary to express, the right questions or, the targeted answers, then it kind of just results in so much more confusion for everybody. So the first page of the document is there's the table of contents. You'll see that that table on the slide there. and it also has some important websites. I drew my information from all of these, all the sources that I listed on the cover page there. But the actual screening assessment itself, it looks at, you know, what the individuals or families' sources of income were from, you know, 2018 to 2020. Based on those answers, then, you know, we move on to tax filing status. And then after that, we'll move on to, you know, have any of the following changed since you last filed taxes, like your direct deposit information, your address, number of dependents living with you. And then there's a set of statements, just a yes or no as to whether those statements apply to that person. And then after collecting that information, the next couple of pages are a screening interpretation guide. It's a very simplified version of the IRS's table on their website, where they kind of outline, you know, use the Get My Payment tool if you're in this situation versus use the non-filers tool if you're in this situation. And I've been on that site and or that particular page, and the table is huge. I mean, if I have a problem with words, my goodness. So the hope here was to not oversimplify information such that it really just lost its actual substance, but to try and tailor the information that was available to some of the most common scenarios that we would see with our patients who are served by our particular clinic. And as far as the screening interpretation guide on pages 3 to 4, then you can take that information and move on to the action plans. I had laid out a couple of different action plans. Actually, would you mind moving to the next slide, please, Charlotte? Thank you. So as you can see here, here's one of the action plans for steps for filing 2018 and or 2019 taxes electronically with the Cash Campaign of Maryland. There was another action plan. I didn't want to overwhelm the slide, but the first action plan was, you know, what to do if you ultimately needed to use the non-filers tool on the IRS's website. So this is an example here of how one of the many ways in which this particular form can be adapted for both your local context, local resources that are outside of the agency. The Cash Campaign of Maryland is an absolutely wonderful organization. They are focused on financial empowerment for those experiencing poverty or financial distress, and they assist with things like free tax preparation. So I had simply referred to them specifically because it was something that was available in our area, and it was also specifically offering a way to help folks prepare their taxes remotely in light of both the current pandemic as well as the extension of the tax filing deadline. And then there's also, you also see, actually, sorry, Charlotte, I forgot that I added some little animations here. Would you mind clicking a couple of times? Thank you. Perfect. And one more, perfect. Excellent. Thank you. So outlining in the kind of first set of boxes, red boxes up there at the top, you know, perfect opportunities to replace those with local resources. For example, if not having a phone is an issue, then we could look at a Lifeline program, and there are various Lifeline service providers. I wouldn't be surprised if Assurance Wireless and Syntex Wireless also operate in West Virginia, given our geographic proximity, but there may be more Lifeline phone programs or government phone programs, as I often hear them called. And then as an example of another way that you can adapt the form depending upon your particular agency's documentation practices and other internal resources. One of the suggestions that I had made for this particular action plan was to prepare for possible verification related requirements with both, let me see here, particularly with getting a Lifeline phone, which is contingent upon one's enrollment in various social services programs like medical assistance, food stamps. I'm forgetting all of the specific eligibility criteria, but primarily it is income-based. And within our own clinic, because it is a medication-assisted treatment site, and that is a billable service that we offer patients, while we will still, of course, serve patients without insurance and help them get enrolled, many of our patients come in already enrolled in medical assistance. And at the time of intake, one of our administrative staff will take copies or scans of their medical assistance cards. So here I had suggested to our counselors in the context of our clinic to take a look at our patients' fee assessments is what we call them internally, and to extract the pages from those fee assessments that contain the copies of their insurance cards. And then that way, you know, when you're helping somebody submit an application for a Lifeline phone and the program requests, you know, that the person upload verification, then you can, you know, just go right ahead and do that. So just a couple of ideas right away where these things can be tweaked depending on what your own agency does and also what's available locally. Thank you, Charlotte. Feel free to move on to that next slide there. Thank you. Oh, and my apologies, I skipped over the last part of the actual screening and needs assessment packet, but the last couple of pages are just tables that outline the information that the IRS requires those who are not required to file taxes. It just kind of organizes all of the information that the person would need to have available in order to provide that and file. So now we can move on to possible interventions or techniques. So the first one that came to mind was motivational interviewing. And of course, this may or may not be appropriate depending upon the home visitor's, you know, particular role at that time. But motivational interviewing is such an incredible intervention because it is so transportable and it's so easily integrated, at least in my experience, into a wide variety of contexts. So one of the things that initially came to mind as far as the use of motivational interviewing was helping the person weigh the pros and the cons of each spending choice. So for example, when Chris had kindly initially connected Jewel and myself with Charlotte and with all of you, one of the biggest issues that was brought up was the spending of stimulus check money on substances. And one of the things that I really appreciated the most about motivational interviewing, because it was so, I guess, just not necessarily counterintuitive, but somewhat counterintuitive, by weighing the pros and cons of every choice and truly taking an objective approach so that the person can themselves list the, again, positives and negatives that could be involved. You know, if you spend money on living expenses or on, you know, expenses for childcare or for, you know, just supplies that the household needs, like diapers or formula, then that's money that you don't get to spend on yourself. And you know, self-care is very important. Feeling good is when we also don't feel bad. So that's a definite plus. And as far as motivational interviewing is concerned, the introduction of these open-ended questions. Forgive me if it looks like I am looking off camera, but I just had some examples in front of me over here because it phrases things much better than I can. And some examples that they give of open-ended questions are, what are the good things about your substance use? Instead of, are there good things about using? Because are there good things about using? It's more of a yes, no kind of answer versus what are the good things about your substance use, or what are the benefits? What would be the good results of spending this money on substances? And the importance of framing it in that way, saying what instead of are, saying purposefully not adding on to that question something like, what are the good things you would experience spending, the money on substances instead of living expenses? Just kind of leaving that last part of the question out because it already introduces it already kind of introduces, I think, the interviewer's bias in that particular circumstance. And of course, we want to see our patients, our families, financially empowered. We want to see them making healthy decisions. We certainly don't want to see them, spending money on substances versus rent or utilities. But if somebody has already decided that that they are going to perhaps push against, something or someone where they feel like they're being judged, then that's just a human response in that scenario. And then also to introducing the cons or the possible, most concerning things about spending the stimulus check money on substances, possible negatives of spending the stimulus check money on living expenses or household items. And just the laying it out in that way, it makes it a little bit more, at least in my experience, a little bit more formulaic, makes it a little bit more approachable. And it can lay it out in a way where someone can come to their own conclusions. And really, I mean, how many times have we all seen that most people tend to do much better when they are committed to doing something as opposed to being told what to do or advised of what is best. Quantifying and using tangible examples. I threw up a couple of phrases that I had come across when I was doing a little bit of research on this, because I had come across literature previously about the ethics of reimbursing participants who are in substance use programs for participating in research projects, because there was also the inherent assumption that the person would then take that research participation money and go out and spend it on substances. And while that could be a risk for some, by and large, it was found to, just basically be seemingly more strongly fueled by a lot of biases as opposed to the research data. However, it has been Charlotte and her agency's experience, of course, that that you all are seeing things like this happening at, not only because of the huge sum of money that it is. I mean, $1,700, $1,200 is much more than, $25 for completing a survey. But then also too, I mean, just the overall, the timing of for information about that. I don't know about you guys, but it just really seemed to be as on the forefront as it was this first time around. So mental accounting, from what I had reviewed, is essentially just this idea that when you begin talking about money in those kinds of ways. And it's essentially just this mental allocation that we can make. You know, if my paycheck is $1,000 and I know that, you know, 500 of that is going to rent, then even if the entire $1,000 is directly deposited into my bank account, mentally, I've already separated that $500 out. And so using other tangible examples, such as, you know, finding out the actual amount of the stimulus check, $1,700, you know, $1,200 plus $500 for one dependent. What other things can that equal? You know, can that equal 2 months rent? That equals a certain amount of substance of choice, a certain number of boxes of diapers, cans of formula. Also looking at it perhaps from a percentage perspective. Something that had thrown this into great relief for me was when I was interning at a rapid rehousing program in Baltimore City, in the course of my MSW program. And one of the required worksheets for us in our home visits with families was the completion of this budget worksheet. And it was very archaic. Like it just didn't seem to, it seemed like the kind of thing that had been just copied over and over and over again over a span of years, and didn't necessarily allow the opportunity for a real conversation around money. And it also didn't necessarily throw everything into perspective. And, you know, it was just asking people to kind of approximate, well, how much do you think you spend on groceries a week? And honestly, if I didn't write that kind of stuff down, I would have no idea. So something that I'd spoken with my field instructor about at that time was instead perhaps looking at expenses as a percentage of that family's income. So in this case, for example, you know, a week's supply of substances of choice is X percent of $1,700, and sort of given that visualization, kind of like a pie chart, so to speak, might be more accessible for some people. And also to this idea of that I'd read about of probability discounting, which is essentially the idea that the farther events are in the future, the less likely we are to feel confident that they'll actually happen. So for example, I think the example that was actually given in the article that I read, and because I'm not feeling very creative right now, I'm just going to go back to their example. It was set up such that people who, you know, were invited to a party, I believe, the next night, I mean, they felt very confident that that party was going to happen. But even if they knew that this was, you know, an annual event or something like that, they still felt less likely that the event would happen next year. Not only because it was less tangible, but then also because, you know, there's such a huge lapse of time. Like what could happen between now and then that could make this other event in the future less likely to happen. So one of the strategies that the researchers had found to counter the impact of probability discounting was to make future events that much more tangible by bringing in some of those concrete examples, specifically pointing to, you know, things like rent, utility bills or utility shutoffs, you know, whether the family will actually have what they need in order to, you know, continue on in their day-to-day lives. And lastly, this also ties in with motivational interviewing as far as the open-ended questions, but I specifically listed this as a separate point because at least in my experience, while albeit limited, comparatively working at our outpatient clinic, it's an interesting, say interesting, but it's quite commonplace. Something that I tend to come across a lot and yet still surprises me is this continued sort of friction between what counselors or doctors are, you know, coming to me and reporting that this patient needs and what the person themselves expresses that they want. And it may just be, that, oh, well, so-and-so has continued to struggle with their mental health and has been through a lot of recent psychiatric hospitalizations. And I think that this person would really benefit from a referral to an ACT team or a sort of community treatment team. And using an actual example, I have then done quite a bit of research on the ACT team under the University of Maryland, gotten hold of the very long referral form, and already started to do some research on the patient's history of psychiatric hospitalizations, so that I had everything prepared for when the patient and I first met. And so I introduced the idea, explained why his counselor and our medical team had thought that he might benefit from this, and described some of the services that would be involved with it. Asked him if he was interested. And for all of that previous discussion, all of the previous research, no. Okay. Well, then that is what it is. And so the opportunity to find out from the person what help they perceive they need, what help they would actually like, what protections or supports they might need for actually making this stimulus check, possibly the next stimulus check, into something that really brings them the benefits, the financial empowerment that they're seeking. And as we again may see in the future, hopefully maybe another round. But pardon me, Charlotte, is there? I forget if Jewel got to his slides. Do we have a next slide?
I think I did add, yeah.
Oh, perfect. Thank you, Chris. So this actually leads into a couple of things that I know Jewel would have spoken about much more eloquently than I ever could, but I had a brief anecdote that I would like to share that kind of leads into this idea of what is your money story? What emotional relationship do we have with money? And I mentioned previously that I had interned for a rapid rehousing program that involved home visiting for case management. And around that time, I'd recently read an article that was published in Psychology Today that was outlining the benefits of using cash as opposed to cards, because the research had showed that when people handed over cash, that the same pain circuits in the brain were activated as when we were in physical pain. But those same pain circuits were not activated when we were handing over a card, because if I'm handing you a $10 bill versus a $1 bill or a $5 bill, those things all look very different. But no matter what the charge is, my card always looks the same. So that pain circuit isn't activated when we are relying on cards. It can be very easy to lose touch with how much we're spending. And they were also talking about this research in reference to the 2008 financial crisis. So I was very excited with about my newfound knowledge. And I was doing a home visit with really wonderful family. That's really neither here nor there. They're very lovely, and I often still think about them. I asked one mother, she said that she felt like she was spending their household's income too quickly. And so me, because I knew so much, brought up this idea that, oh, well, here's what I read. Maybe using a cash-based system. If any of you are familiar with Dave Ramsey Financial Peace University, the envelope method, actually physically putting money into envelopes, and when there's no more money in the envelope, you can't spend any more money in that particular area. So I thought that maybe suggesting something like that, using cash instead of a card, might be helpful for her. But she said that for her, establishing a bank account, getting a direct deposit card, might actually be better, because whenever she had cash in her hands, she just felt like it would disappear. Not that she necessarily thought that it would be stolen, although that very well may have been a legitimate risk for her, but the way that she described it, it was almost like she was like she felt like she was trying to hold water or sand in her hands, and like it was just running right through her fingers. And because it wasn't something that she was used to having. And so she didn't know what to do with it. And out of fear that it would just fall through her fingers, that she just wanted to spend it compulsively on things that she thought her family needed. And she eventually, thankfully, did have a happy ending, in that she was able to, get the supports for her that she needed in that particular moment. But getting that information from her, reorienting myself to her reality, was so important, because it completely changed the protections, the supports, the education that she might be seeking. And of course, that also then changed how I would support that. Money is a thing that, at least in my household, we didn't talk about because it was rude. And so because it was never something that we talked about, it was always a very almost scary thing, because of course, when we don't know something, or don't really have an easy way to talk about something, can feel very intimidating. And to this day, I have no idea how I managed young adulthood because I'm still not an adult. Who am I kidding? And also to kind of along with that, eliciting from clients what their experiences have been with money. Where do they feel, if they, and of course, if they feel comfortable opening up to this degree, do they feel vulnerable about it? Are they scared of it? Are they angry or resentful? And then kind of taking what I learned from that particular client, and then incorporating that into the plan going forward for us is, very similar to how we would do basically really anything in the human services field, incorporating contingency planning into models that we're already using, like addictions counseling models, relapse prevention, mitigating risk, contingency plans. If that person is very afraid about having the cash from the stimulus check, or the direct deposit card that it's sent out on, because they feel as though they do need some kind of protections to help them curb some kind of impulsive spending, then, mapping out a contingency plan. Will you make sure that you will always like text a friend or something, sort of proposing a series of hypotheses, if this, then that, and just sort of even perhaps practicing some of those scenarios, behavioral activation, helping people feel comfortable with the ideas that they have come up with for themselves, because they know that it's something that will actually work for them. Again, Jewel probably definitely would have done a better job at going into all of those, but I also just noticed the time. So I think that's it for me.